Does the injection site matter for GLP-1 medicines? All approved injection sites for GLP-1 medicines deliver equivalent medication exposure, though proper site selection and rotation help prevent tissue damage and maintain comfort. Before we start, a quick note. This video is educational information only, not injection training or medical advice. Always follow your pen's patient information leaflet and the instructions from your prescriber, GP or pharmacist. They'll show you the proper technique for your specific medicine. If you're using a GLP-1 medicine, you might be wondering whether it actually matters where you inject it. Let's talk about why injection site selection is more important than you might think. In the UK, these medicines include semaglutide, which is licensed as Ozempic for type 2 diabetes, and Wegovy for weight management, plus liraglutide as Saxenda for weight management, and Victoza for diabetes. Whilst all the approved injection sites deliver the same amount of medicine into your system, choosing the right spot and rotating properly can make a real difference to your comfort and skin health. GLP-1 receptor agonists work by mimicking a natural hormone in your body that helps regulate blood sugar and appetite. These medicines are given subcutaneously, which means into the fatty tissue just beneath your skin, not into muscle. This allows for gradual, sustained absorption, which is exactly what you need for these treatments to work properly. You've got 3 approved injection sites to choose from: your abdomen, your thigh, or your upper arm. Research shows there's no clinically relevant difference in how much medicine gets absorbed between these sites, so you're not getting more or less of your medicine depending on where you inject. That's reassuring to know, but here's why site selection still matters. Different areas of your body have varying amounts of subcutaneous fat, which can affect how comfortable the injection feels. More importantly, if you keep injecting in the exact same spot, you can develop something called lipohypertrophy, which is basically fatty lumps under the skin, or lipoatrophy, which is loss of fat tissue. Both of these can affect how well your medicine gets absorbed and can make injections uncomfortable. This is where rotation comes in. You need to systematically rotate your injection sites, as advised in your patient information leaflet or by your healthcare professional. Think of it like a grid system. When you inject, make sure your next injection is at least 2.5 to 5 centimeters away from the previous spot. You don't need to switch body areas every time, but you do need to move around within that area. Avoid injecting into scars, moles, or anywhere with skin abnormalities. These areas can affect absorption and increase the risk of irritation. Now, the upper arm can be trickier to reach for self-injection. Some people find it difficult to inject there on their own and may need a caregiver's help. Your patient information leaflet will have specific guidance on this, so do check that. Let's talk about some common mistakes people make. The biggest one is injecting repeatedly in the same spot. It's easy to fall into this habit, especially if you've found a comfortable area, but it really does increase your risk of tissue damage over time. Remember, your healthcare professional can give you personalized advice based on your body composition, any skin conditions you might have, and your specific medicine. If you're finding injections consistently painful or you're worried about your technique, don't hesitate to ask for a demonstration. Practice nurses and diabetes specialist nurses are brilliant at showing you proper technique. Now, let's talk about when you should contact your doctor. Some mild redness or slight swelling right after an injection can be normal and usually settles quickly. But if you're experiencing persistent redness, ongoing swelling, or pain that doesn't go away, you should speak to your GP or diabetes specialist nurse promptly. If you notice lumps developing under your skin at injection sites, that's also worth discussing with your healthcare professional. They can check whether you're developing lipohypertrophy and help you adjust your rotation technique. So to recap, all approved injection sites for GLP-1 medicines deliver equivalent medication exposure, but proper site selection and rotation prevent tissue damage and keep you comfortable. Rotate systematically as advised in your PIL, maintain proper distance between injection spots, and avoid problem areas like scars or moles. And if you're experiencing persistent injection site reactions, speak to your healthcare professional. Have you found a rotation system that works well for you? Drop a comment below and share your experience. And if you found this helpful, Give us a like and subscribe for more practical medicine advice from Bolt Pharmacy.